Measuring shoulder abduction, patient will be in a seated or supine position. Just keep in mind that the supine position, gravity is eliminated, while in a seated position, they will be working against gravity. So be consistent whatever way you do it. To perform this, you want the axis of your goniometer to be on the humeral head, the stationary arm running parallel with the body, and the movement arm running along the shaft of the humerus. Now, when your patient performs abduction, you want to make sure that their thumb leads the way and that their palm is towards the ceiling, just like this. So Rachel, if you could, perform full abduction for me. Thank you. So have that on the humeral head, running alongside the shaft of the body. And we're looking at 175 degrees.